Well, it's a story that is sending fear to newborn parents everywhere. Earlier this week, a 3-week-old infant died after she contracted a deadly virus from a simple kiss. Joining us now to talk about the risks of meningitis facing all of us is Dr. Richard Chaffoo. Dr. Chaffoo, this is pretty scary. Let's talk briefly about what happened in that Iowa case.
Sure, and there are a lot of unanswered questions in that, Maria. You know, the parents seem to be very proactive. The take-home message for parents is that meningitis is a disease that can cause a rapidly progressive demise, and certainly the things to look for in a young child are, lack of eating, irritability, sleeping, not just not being themselves, and of course a high fever, because remember, infants are not historians like you and I. We can say we have a headache or a neck ache. There's just the child being off, not acting right, not seeming to be himself or herself is really enough of a reason to call your pediatrician.
Dr. Chaffoo, you and I are both parents, and we know what it's like. You had twins even, and you know what it's like. Everybody wants to see the new baby when you get home. Aren't some germs good for them? We've heard that. It's like an old wives' tale. It's good to expose them.
You're right, Maria. And the other thing for parents to remember is that we don't want to forget that, for the first few months of life, there is this passive immunity that's passed from the mother to the newborn, so there is protection against many infections. So this case is a very unusual case, to stress that, and really most cases of viral meningitis are not the type of HSV that we saw in this young child. There are what are called the non-polio enteroviruses, and there's really no vaccine against it. Now, the important thing I think for parents to remember, Maria, is strict hand washing is really important. You can't overemphasize that. Parents get tired, they're sleep deprived, and they're changing a diaper in the middle of the night, and then they may forget to wash their hands, and the baby just needs to touch an area and get it into their mouth, and they can get this enterovirus or certainly bacterial infections, and they can be very serious. So, besides, we want to make sure that we're washing our hands frequently, use wipes or other disinfectants to wash down toys, surfaces, doorknobs, other areas where the child will come into contact with possible organisms.
And of course, make sure that the people who visit are not sick. I mean, that's a big part of it too, correct?
Yes, absolutely. If you're not well, if you have any kind of illness whatsoever, then please stay away until you're well. Don't go and potentially expose a child to some, potentially life-threatening problems. Their immune system, although it's passed from the mother to the child, we need to remember it's still attenuated or not what it is in an adult like you and me.
And very quickly, Dr. Chaffoo, before we go, a large number of people carry this type of specific virus, but it often lays dormant. It is just important to ensure that you're washing your hands and just being very clean, correct?
Correct. HSV is a very ubiquitous organism. It's found in cold sores. There's another type from genital warts, and either one of those can cause an infection around the brain. But they're very common, and usually most of us, by the time we're adults, have already developed antibodies to protect us against those infections, but we need to remember that's not necessarily the case in a young child.
So maybe just keep them extremely protected during the first few months. Dr. Richard Chaffoo, always good information. Thank you so much.